Hello and welcome to another fantastic expert interview here in the BodyMind Performance Certification. It's wonderful to have you here. Today we have a very special guest, Dr. Nunnally, who has a biological dental practice in Marble Falls, Texas. Dr. Nunnally, welcome to our call.
Oh, it's a privilege to be with you, Lars. I look forward to this visit.
I as well. Dr. Nunnally, you have an amazing story. So can we get started with not only your story, but also the significance of biological dentistry?
Well, sure. I had thought I was a fairly holistic dentist all the years of my practice. I had practiced for 20 years when I actually became ill about 15 years ago. I hadn't not been putting mercury fillings in, which I thought sort of designated me as a holistic dentist. But I had been removing mercury fillings fairly aggressively. There were a number of physicians in the United States who knew about me and knew that I wasn't very fond of having mercury in the mouth. So they would send their patients to me and I would remove them, but I was not taking any precaution myself. And so as it turned out, I sat in this little mercury vapor cloud for a number of years while I was working. I was very fit and a competitive triathlete and felt like I was bulletproof, all to find out one day that I began to have neuromuscular issues. And finally, after months of being through various diagnoses, I was finally referred to what's called the Lou Gehrig Center or ALS Center in Houston, thinking that I had ALS. So at that point, things seemed very bleak for me. And so interestingly enough, Lars, my wife and I both traveled to Canada to see the old grandfather of holistic dentistry, and his name was Hal Huggins. He had been seeing patients from all over the world for years with all sorts of autoimmune diseases and other degenerative diseases. And so I called him and said, "Hey, I'm a Texas dentist. Looks like I've got Lou Gehrig's disease. Would you mind seeing me?" And at that point, he was seeing patients in Montreal and in Puerto Vallarta because he had long since lost his license in the United States for telling people to have their mercury fillings removed and their root canal teeth removed. So he was kind enough to see me. He instructed a dentist in Montreal to actually redo all of the dentistry in my mouth, which I had done in my own office. But as it turned out, all of the materials we had put in there, even though they didn't contain mercury, they were still highly reactive for me. Wow. There are two places in the world where you can have your serum, your blood serum, sent to see what materials you're compatible with and what materials you're not. Well, virtually everything that we had put in my mouth over the years, as we removed the mercury fillings from my childhood, all of those were highly reactive for me. So he had the dentist in Montreal remove those for me, and he took me through a very intensive 8-day course where he analyzed my blood, hair, and urine, and helped. Even though I had a master's in nutrition, meeting him was a real paradigm shift for me. I'll never forget the first thing he said was, "How would you like to eat 2 eggs and a stick of butter a day for the rest of your life?" Because he knew what it took to build nerve tissue, and we all at that time assumed I had ALS. So at any rate, that whole encounter with Hal Huggins was a life-changing event for me. And I've always been sort of an all or none person. So I came back to Texas. I recovered over the next 3.5 years, was finally able to actually become a triathlete again. But in the process of that, We added on a whole new wing to our office, doubled the size of it, made it almost as if it's a clean room in terms of being able to eliminate mercury so that I wouldn't be exposed anymore, nor would my patients or staff. And as a result of that whole experience, patients began to find out about my story, and then physicians around the world know about these issues between the link between dentistry and our systemic health. And so before you know it, I was really, my practice was transformed from one of being kind of a cosmetic, sort of semi-holistic practice to being an all-in, what I would call today a biological practice, where we really pay strict attention to what materials a patient is compatible with, to where we're really looking as deeply into their systemic health matters and what impact we would have on that from a dental standpoint, as we would be looking at cosmetic issues and so forth. I like the blend of them. We still want our teeth to look nice, but it's possible to do that today with the materials that we have in a way that we are not offending our systemic health. So that's what happened. And of course, now I'm very, very thankful for it. 15 years ago, it was a tough time for me and my wife and my kids. But today we're very grateful that I got to go through that whole experience, because now 95% of the patients I see have some sort of degenerative illness, usually autoimmune disease or cancer. They've been referred there by a physician or healthcare provider somewhere around the world for us to remove anything that might be a systemic health challenge, a toxicity. For example, it might be heavy metals. It might be toxicities from a particular bacteria that we can harbor under our gum tissue. It can be the bacteria and toxicities that inhabit root canal treated teeth, or even many of your listeners may have heard of a condition in dentistry. It's most often referred to as a cavitation. Cavitation being an area, usually in an old extraction site where a tooth has been removed, where it never has completely healed, and you have a festering infection below the gum line there that can be a real challenge to our systemic health. So those are the sorts of things that we end up treating when folks come to see us.
Wow. Through adversity, life can bring about an incredible future. And thank goodness you followed that track, followed your intuition, and really went all out. Thank goodness you are an all-out person, because you are bringing this out to the world, and through mediums like this and other interviews, really waking people up, giving them really the power in their hands. Now, from the biological compatibility perspective, one of the thoughts that comes to my mind is, if I were to head down and see you, is this something that we need to get tested in advance, or when we get down there? What does that look like?
Yeah, most people are actually tested in advance.
Okay.
And so we send the test kits to the patients, and they simply go to a laboratory that draws blood, and that blood then is treated in a way that laboratories are familiar with. And then they send that to the laboratory, and typically the patient and I both get a report back within a week, and we know what materials can be used. So we wouldn't dream of doing dentistry for someone without that report. There is, believe it or not, today, there are actually a few materials that seem to test uniformly compatible for patients. So if, for example, a patient, usually the way this works is patients will email to us usually it's a panoramic x-ray of their jaws, and it shows us kind of the whole condition at one time. And we can look on that x-ray and basically tell what the patients had previously done, and then we can recommend them what we would do and what the fees would be and the time involved. Usually we remove everything at one time. We think it's best to do that if it's done safely, so that the patient's immune system has a great jump start. So, and that's typically the way the physicians who refer to us want to have it done. I think most of them feel like they see the best results when all the toxicities are removed at once. But usually a patient will just send us one of these x-rays, a panoramic x-ray. They'll send it digitally, and we'll look at that and then we can respond back to them on what we think needs to be done. If they only need fillings and no other types of treatment like crowns and bridges and so forth, we can often, there's a material that we have found is every single patient we've ever tested, which is several thousand, have tested compatible with this material. Materials made by a German company, and I'm just going to mention the name of it because the company is Voco, V-O-C-O, and they sort of specialize in making biocompatible dental materials. So we can use one of their products and feel like, even on a patient who hasn't been tested, it's going to be compatible for their immune system.
There seem to be a lot of materials that are used unanimously in dentist office right around the world. And I think of myself, I had dentistry work done in East India where I grew up, in South America, in Canada. So I have a mouthful of all sorts of potentially non-biocompatible material. What are the things that we can look out for, at least be aware of initially?
Well, if you look in your mouth and you see dark fillings, dark is not good. Dark usually means that's an amalgam mixture which contains mercury. And the typical mercury amalgam filling, which I certainly had as a child, and so many of us around the world had and have today. It's hard to believe that these things are still being placed. But in the United States, only half of the dentists now, only half have opted out of not putting in mercury fillings. Wow. So that amalgam mixture is 50% mercury. The rest is silver, tin, zinc, and copper. And anytime you put metals together, that's not the same kind of bond that we think of that's a stable bond. That's not a stable bond. Those metals continue to leach out of there. This is very well documented in the science, and even anecdotally, you can go on any YouTube and see this mercury plume coming off of an extracted filling. Well, that's not trickery. That's that's exactly what happens. You never ever have a day after you've had a mercury filling that you're not being exposed to that mercury vapor. Mm. So first thing is, if the filling looks black, it's not a safe filling, in my opinion. Our own American Dental Society would argue vehemently with me about that, but I think the science is well on my side, or I wouldn't be doing it, because the science does say there's no exposure to mercury. I don't care if it's just an atom a day that's acceptable. Mercury is a toxic, most toxic element on the planet, except for plutonium. So we do not need to have an exposure to mercury, no matter what the exposure is. And then there are other metals too that I'm not very fond of. One of them is nickel. Nickel is a carcinogenic metal. Over 50% of the women in America are reactive to nickel because we've been exposed to nickel through so many things. Stainless steel cookware, for example, has about 70% nickel in it. And so through cooking, through wearing costume jewelry, all sorts of things, we get exposed to nickel. And so oftentimes I look in the mouth of a patient and I see a crown that's composed of nickel, or I see a child who has these little stainless steel crowns on all of their teeth. And you look at the tissue around that and it'll look very inflamed. And the reason is the patient is reactive to that. So it keeps the immune system on constant alert. The immune system constantly has to battle that. So nickel's one. Cadmium's, and there are a number of different metals that have been used in dentistry over the years that never should have been used, in my opinion. And I think we're beginning to make inroads into that, but unfortunately, it's still accepted by our dental association in the United States, and certainly by the Canadian Dental Association as well.
Mm. Now, one of the fillings that I have is a ceramic filling. How does that fit in?
Most ceramic fillings, of course, they're far less toxic than a filling that contains mercury. Mm. But there are some ceramics that are loaded with aluminum. Mm. And the two materials, quite frankly, I think it's worth mentioning these names, because as patients look for biocompatible materials, I'll say that one material sort of in the ceramic realm, but it's not a ceramic, that tests well most times is zirconia. Zirconia, and zirconia is actually even being used as an implant material today, in place of using titanium. If we were to place an implant in our office, we would opt for zirconia, because I think the profile for it in terms of its toxicity is better. And then the other material that I think is worth mentioning is a material that's made mostly of lithium. It's a dilithium silicate, and it's called Emax. So those two materials, interestingly enough, are beautiful. They are white like our teeth, and they're typically materials that are made in a laboratory and can be put on a tooth, most times very safely.
I'm so grateful that you're giving us the names, because I myself will be taking the notes, and I was saying to my wife, we're headed down to Dr. Nunnally's office as when we get our. There's a lot of work to be done. There's, like I said, several countries worth of fillings in my mouth, but there are a lot of folks that don't know what to ask for, and don't necessarily know what the side effects would be, what they could be looking out for in terms of what can be happening to them, because the mouth is connected into the entire system of the body.
That's the problem. That's the problem, Lars, is that toxicities typically don't have much of a barrier. So they can go anywhere, especially mercury. Mercury loves nerve tissue, so it loves the brain. That's not the only tissue it loves. It loves the thyroid. It loves the prostate in men. It loves the uterus in the women. Mercury it spreads ubiquitously. And we have seen, of course, this is very well documented in the literature. There's no place where it doesn't go once you're exposed to it. So I just think it's best not to be exposed, period. And the other thing that makes this so difficult is since there is no barrier to it, symptoms are broad and varied. In terms of most exposures to, sometimes you'll have a specific exposure where maybe just the kidneys are involved, or sometimes where just neurological tissue. But in the case of mercury, since there's no tissue that's not affected, you can have this broad array of symptoms, everything from a rash to the inability to get out of bed, to the inability to think, to unbelievable depression. So I wish it were much more specific in its action, but it's more of a shotgun approach that mercury takes, for example, to our systemic health.
Right. And one thing that comes to mind is the reactivity inside the mouth to foods, all the chemical reaction that happens as we break down food. Then we have pop, we have soda drinks, all of these different types of reactions going on inside of our mouth that break those metals down and those fillings down.
Oh, you're exactly right. And when you put more than one metal together in a mixture, you form a current. You produce a battery. Those currents are known as galvanic currents. And these have been written about in the literature. They were really written about in the 40s and 50s. There's a lot of literature about galvanic currents and how they disrupt the other natural currents in our body. You know, we think in Western medicine, we think about currents in our brain, we think about them in our heart, but we know that every cell has a current. And there are these magnificent currents that were put in us. And the currents that we generate in our mouth through these metallic restorations can completely overwhelm those other currents so that they block the beautiful flow of electricity that we have in us. Mm-hmm. And so many times I think when we see dramatic improvements in a patient's health, I honestly don't think the body has had enough time to adjust to the chemicals, but it responds to these currents being removed. The body loves to have, for example, teeth. We test this on people. We test it in microamps. In other words, millionths of an amp. We test these currents to see how strong they are when coming off of various metallic restorations. Well, when you test the enamel of a tooth, it's zero. We can't read the current. There's probably a current there, but it's no telling how small it is. We certainly can't read it with the machinery we have. But you can read the currents coming off of the metallic restorations easily. The body loves to have an oral environment where those currents are low or nil. And you're exactly right. The foods we eat, especially the acidic foods that we eat, just generate more current. Or of course, or if we eat something hot, anything that would stimulate electrical activity, like heat, like friction, like chewing, or acids, will all amp up the current.
Short of going on a liquid-based alkaline plan, there are not a lot of people that will be able to do that. So what are some suggestions in terms of self-care? Like the toothpaste that we have, the options out there, is it as simple as something like coconut oil or something like that?
Coconut oil is not bad. I like coconut oil. My preference in terms of toothpaste is a little baking soda, a little salt, and a little hydrogen peroxide. If you want to throw some coconut oil in there or a little bit of essential oil to improve the flavor, that's great. But if you take a mixture of about 80% baking soda with about 20% salt, and then you take and put a little hydrogen peroxide on your toothbrush, and you dip it into this bowl full of salt and soda mixture, you get quite a paste on the end of your brush. It's a wonderful way to clean your teeth. And most of the harmful bacteria that we find under the gum line in dentistry are very much opposed to that mixture. And they are impacted by it for a couple of reasons. One, salt is antibacterial. The baking soda and the hydrogen peroxide really liberate a lot of oxygen, and the bacteria that we find that are harmful basically don't like oxygen. Most of them are anaerobic. So I love that little combination. Now, some people don't want to brush with that 2 times a day. So I say, okay, we'll brush with it at least once. And the other time you use the toothpaste that you like the most, as long as it doesn't have 2 ingredients in it. One fluoride and the other sodium lauryl sulfate. Those 2 ingredients, in my opinion, should never be put into toothpaste, and we shouldn't be ingesting fluoride in virtually any form anyway. It competes too much for our thyroid hormones with iodine for our thyroid. So, and there are a number of other reasons I don't like fluoride, not to mention that the peer-reviewed science so totally is convicting in terms of not using fluoride, or especially putting it in our water supply. That's the most absurd thing ever. And but at any rate, it's one of those old things that we've continued to adopt and use over the years. But I would never recommend a toothpaste with fluoride in it.
I'm glad you brought those points up, and thank you for that formula. That's so fantastic.
Mm-hmm.
Now, someone has a little bit of an ache in their tooth. There's something going on there, and if they let that go, as I did during a very stressful time of my life, it ended up as a root canal.
Mm.
So can we get into root canal therapy and why it's becoming controversial?
Sure. And first, let me just start out by saying I did hundreds of root canals for many years and was a firm believer in it. I didn't know the research associated with it in terms of the toxicity associated with the root canals. Never had even heard about it. But I do know that research now very well. And it's, again, it's so convicting that I personally would not do another root canal treatment. And I haven't done one since I learned about the root canal issues. Well, what are the issues? First of all, let me just say that not everyone is impacted negatively. At least it doesn't seem to be by having root canal treated teeth. I have very old patients who seem to be in very good health who have multiple root canal treated teeth. So this is not a message about creating panic. I just want to give you the science behind this. And the science is this. Some people are negatively impacted by the toxins associated with the root canal teeth. How do you get toxins in a root canal tooth? You get them because when a tooth is treated with root canal therapy, you can never totally clear the tooth. You cannot sterilize the dead tooth. So now you have a tooth that continues to harbor bacteria. It loves to be in a dead tooth because now there's no natural blood supply that the body can bring to the tooth because that's severed during the root canal process. And so you cannot bring your own immune system to the tooth to fight off the bacteria. Well, the bacteria are a problem in themselves, and they don't just stay in the tooth. They can migrate anywhere they want. But as it turns out, the toxins that those bacteria produce are probably even a greater issue than the bacteria themselves. I hate to say this, but this information was actually made very clear in 1923. Weston Price, one of the greatest researchers of all time, printed a 2-volume, 1,200 pages on this very subject, only to have that put aside. And it's a fabulous, fabulous treatise on the impact of bacteria and root canal treated teeth and other dead teeth and the toxins that they produce. So I say that to say that I don't feel like every person needs to clamor in a panic to a biological dentist to have his or her root canal treated teeth removed. But as you know, I see a group of people from around the country and really around the world who have been referred because they have had some kind of demise in their health, many times after having only one tooth treated with a root canal. And so their physician or someone knows about this, and they'll send those patients to us, and we'll remove it in what I consider a very safe manner. And most times those patients have dramatic improvements in their health. And so I've seen this now so many times. And I even published a paper on this in 2012. The paper was published in the Journal of Orthomolecular Medicine, where it talks about the toxicity of root canal teeth. No matter how well the root canal tooth was treated, whether it was treated by an endodontist, a specialist in the field, or by a general dentist, made no difference what the material was used to fill the root canal teeth, no matter how beautifully they're done, still have a toxicity associated with them. Lars, the thing about it is, see, you may be doing so many things marvelously health-wise that your immune system can handle. You know, I have a dear friend who's 90, and she has smoked for 75 years. And she's had a pretty stiff drink of whiskey for most of those years too. and she's living about as robustly as anyone I know. So I doubt if a root canal tooth would impact her very much. But we see so many people who are impacted by the toxins of the environment, and then all of a sudden they get a root canal tooth and they reach a tipping point and they become ill.
It is one of those factors, providing the body with the tools it needs and taking out more than what goes in, right?
Mm-hmm. Correct.
So when we have a tooth removed, is there a proper procedure to that whole process?
I think there is a proper procedure for it. We follow a very strict protocol. This is not followed in many places around the world, but we've just found that a certain protocol works beautifully for us, and that is this. We like for our patients to have a high dose of vitamin C during the treatment. There's great data to show of the wonderful properties that vitamin C has in terms of two things: detoxifying an area and also increasing the speed of the healing. So we give patients a high dose of vitamin C. We typically give it intravenously. We like to remove the tooth in such a way that not only do we remove the tooth, but those toxins also embed the lining of the tooth to the bone, so we clean those out. There's oftentimes a ligament that's left that was supporting the tooth to the bone. I think it's important to try to remove that ligament. That's called the periodontal ligament, because the ligament in some ways precludes bone from growing back into that area once the tooth is removed. We like to use a couple of other things. I'm a big fan of ozone therapy. Ozone therapy for example, we would rarely ever use an antibiotic when we're removing teeth. It's like removing a splinter. Once you get the splinter out, the infection is gone, and antibiotics are just rarely ever needed. I think they're used way too often. So it would be rare that we would use an antibiotic. But we like to use ozone therapy because we can put a little ozone in the area of the extraction. It's a fabulous antibacterial, antifungal, and antiviral agent, and it's actually what our own body uses to fight infection. Our own white cells release ozone as they go in and to kill invaders. So we love to use that. And probably one of the biggest game changers for us over the years has been the use of the patient's own platelets and stem cells to pack into the area when we do any surgery, but especially if we're removing a tooth. We'll draw a couple of extra tubes of blood and spin their own platelets and stem cells out. They come out in a beautiful little fibrin plug. It almost looks like a 2/3 of a cigarette, but it's their own platelets. We can manipulate those platelets in all sorts of ways. We can trim them into little tiny pieces, little BB-shaped pieces, and plug those into the surgical site. Maybe we want to, at the end of it, maybe we want to cover the entire thing with a sheet of platelets. We can press the platelets into a beautiful sheet and just suture that into place, so they have this marvelous area that heals almost miraculously. I think platelets and stem cells are miraculous anyway. So when we can concentrate them into a wound, things just heal so much more quickly. That has been one of the biggest game changers. We've only been using those personally in our practice for about 4 years, and we think it's a huge advancement.
These are incredible advancements. So if someone has had their tooth removed, how about how it should also be replaced?
Great question. What I think they should try to replace the missing tooth in a way that's least invasive as possible to the adjacent teeth. So let's say, for example, they do have a natural tooth on either side of the area where they've lost the tooth. It's not uncommon in dentistry for a dentist to recommend literally grinding those two adjacent teeth down for crowns, and then those two crowns support the false tooth. And that's kind of nice because it all gets bonded in and you don't have to take it in and out. The problem is you've ground down two teeth, many times two perfectly healthy teeth in that process, which can lead to problems in the future. So our options would be this. Let's say a patient comes to us and they have a blatant autoimmune disease. They have a very challenged immune system. What would we do? Well, we would recommend, in the case I just talked to you about, we would just recommend a little removable tooth where nothing has to happen to the two adjacent teeth, and we're not doing any more surgery, no implants, nothing that's going to challenge their immune system. Because I don't care if we were to use, let's say, for example, even a zirconia implant, which we think is by and large a biocompatible material. When we use that, it still doesn't have the patient's DNA on it. It's still going to arouse some sort of an immune response. So we want, in most of our patients, especially patients who are referred, who are sick, we want to be as gentle as possible to their immune system and do the least amount of dentistry, the better off you are. Mm-hmm. So just doing something non-invasive is a great approach. It may be that in a year or two, for example, that patient who's very brittle, who has all sorts of issues, degenerative health issues, they may rally and be back on top of their game. And it may be that in the future, then they could have a zirconia implant. But the one thing I would not do is I wouldn't go grinding good teeth down for the sake of putting in a bridge when I could do something removable, not quite as convenient, but something that's not going to possibly be an issue for the patient down the road.
Dr. Nunnally, you had brought up a word earlier, cavitations. Can we get into that now?
Okay, so let's say the person has a tooth removed, and maybe a year later, a dentist takes an x-ray of that area, and instead of seeing bone in that area, you see a dark area on the x-ray where it has not healed. And when you see that, that's typically a cavitation. A cavitation is an area where either residual infection remained or the tooth was removed, the gum tissue and bone grew over it, but it captured some bacteria in there that have now become anaerobic, and they are a toxin-producing machine. Typically, when we analyze these bacteria via DNA analysis, we find that there are just as many or more potent anaerobic bacteria in these areas as we find in root canal treated teeth. Many times they're the same types of bacteria. But the way to treat those is, and this again is well documented in the literature, the best way in my opinion is to surgically make a small incision over the area where the tooth was removed, reopen it, clean that area out surgically. It's typically not a painful procedure. Clean that out and then go through that same protocol that we use for an extraction, where we pack their platelets into that site, give them high dose vitamin C, all of those things that we like in our protocol, even that we love. We have an acupressurist on our staff, which is kind of like an acupuncturist, but without using the needles. That what their intent is not only to relieve pain and calm a patient's immune system, but to also help open up those electrical meridians that help a patient to heal. So that's what I do for a cavitated area. The problem with cavitation, Lars, is that they're not all, well, about 50% of them are visible on x-ray and about 50% are not. So one way to determine whether you have a cavitation is to have what's called a cone beam, which is basically a CAT scan of the jaws. We don't always do that in our practice, although we have the equipment, because we've treated so many of these over the years. We typically we know we can see very vaguely. I wouldn't have known this 15, 20 years ago. But now, having treated so many over the years, I can tell most often when an area is cavitated. But if I were a new dentist learning how to do this treatment, I would routinely do what's called a cone beam um, scan, and that gives us a three-dimensional image. It's truly a CAT scan of the jaw, and it allows us to see it. The only disadvantage to it is it exposes the patient to a bit more radiation, and we like to try to minimize that.
Mm-hmm. So once cavitations have been resolved, do they come back once in a while, or?
Well, that's been the issue. There are 12 studies that have been done over the years, and unfortunately, in those studies, 40% of the cavitated areas that were treated in the way I just described in terms of surgery came back. Now, in all of those, not a one of those had platelets introduced into the surgical site. They didn't have high-dose vitamin C. They didn't have those parts of the protocol that I think are so important. But a cavitation can definitely reoccur. We honestly believe that since we've been using platelets and the rest of the protocol that we use, we think we're close to 0% reoccurrence. But there may be an occasional patient where no matter what we do, we can't get the whole thing to heal and we have to go back and retreat it. It's very, very rare that we have to go back and retreat one of these today. In the past, I will say, we did have to go back and retreat them. And there are certain patients, very few, but there are certain patients that I retreated multiple times before we got the kind of result we wanted.
Is there a nutritional protocol that your patients have when they leave your office to ensure that they are fully supporting this amazing work you're doing?
You know, most times our patients come to us from someone who's quarterbacking that end of their health a little bit more than we have time, because most of our patients literally fly in and they're maybe there from a Sunday to a Thursday, and then we get their treatment done and off they go. Now, especially since I have a master's in nutrition, we love to emphasize nutrition, and there's probably nothing more important for their healing than good nutrition. What would that look like? For us, it would be lots of good fat. Good fat being olive oil, avocado, non-pasteurized, non-homogenized butter, cream. We consider those wonderful good fats. Oils from other non-roasted nuts and seeds. All of those wonderful oils that most of us in the nutrition world regard as healthy fats. We want people to have a lot of that, because most oftentimes they're the system that gets maybe challenged the most through dentistry is our neurological system. And in order to build new nerves, you got to have good fats, because the majority of the nerve is fat and cholesterol. So we recommend that, and then we want the patients to have a good, healthy, clean source of protein. For us, that's basically anything that's pasture-raised, non-GMO raised meat, just about of the patient's choosing. I'm not that fond of pork, but I am very fond of everything from venison to pasture-raised beef to free-range chickens. And I'm a very big fan, unless a patient is allergic to eggs. I'm a big fan of patients eating eggs. I eat probably at least a dozen or a dozen and a half a week myself. And then finally, what are you going to do in the way of carbs? Because you got to have protein and you got to have fat, but you also have to have some carbs to run on. And so the carbs that we would want people to run are just non-processed carbs. So we love any leafy green vegetable, and organic, of course. To continue to introduce toxins into our system through non-organic greens is a mistake. We need to spend the extra and make sure we're eating organically. And so we love any kind of really little bit less on the fruit, but organic vegetables of just most any sort are what we recommend for our patients.
Mhm. Thank you for that.
Mm-hmm.
Now, with the detox protocol, is it a good idea for folks to get all of the toxins in their teeth removed all at once, or in stages? And are there other things that people do around it, like chlorella or
Sure.
chlorophyll or something like that?
Oh, great. That's, I think it's best, and most of the people who refer to us like to have their patients have all of the toxicities removed at once. I've always felt like patients responded best that way if it was being removed in a very conscientious way where a patient's not being exposed to the mercury. By the way, while we're on that, the International Academy of Oral Medicine and Toxicology at the IAOMT.org has now put forth a complete protocol for safe mercury removal. And a dentist can go through that training, and if they go through that training, they're certified as a smart dentist. That's safe mercury amalgam removal technique dentist. And so if a patient in Canada, anywhere around the world, wants to go to that website, they can see where a dentist in their locale might be who is SMART certified. And I can tell you that the training for that is really quite rigorous. And I would feel very confident as a layperson going to a dentist who was SMART certified. Not only are they going to take care of the patients themselves and their staffs by removing it safely, but they're also going to take care of the environment, because there are several strict criteria for a smart dentist in terms of not passing the mercury that comes out of someone's mouth right out into the public water system. Mm-hmm. So I throw that in there as an aside to say, yes, number one, I think it's best to remove the toxicities all at once. I think that's especially true when a patient is sedated, so they're really calm and they're not having to undergo a long procedure in a stressful way. So we like to sedate our patients and get everything removed at one time. If the dentist is not used to delivering dentistry that way in his practice, then I think it's probably better to break it up and do a little bit, maybe do it in 2 or 3 or 4 visits. And then in terms of what you asked as far as toxicity goes, I think it's really better, Lars, once a patient has had mercury fillings removed, other toxicities, is not to get in too big a rush in terms of detoxifying. Because many times when we detoxify, if we do it rapidly, like there are some chemical agents that can help you detoxify. DMPS is one, EDTA. There are a number of different DMSA. There are a number of different chemicals that can be used to detoxify. And I'll have to say, there are physicians around the world who seem to know how to use those chemicals well and detoxify a patient maybe a little more quickly. But I also see patients who get on chemical detox programs and they become more sick, and it's really because they're becoming retoxified. They're being re-exposed to the toxins because the chemicals shake so much of it loose they can't capture it all, and now you become retoxified. So in my own case, and I had the highest levels of mercury to date that I've ever seen. In my own case, I chose to take a real slow approach to this. I chose to use an infrared sauna where I could sweat. That's a wonderful way and a gentle way to detox. I chose to use vitamin C in high doses, which is also a good way to detox because it amps up our levels of glutathione, which is really what God put in us to help us detoxify from heavy metals. And so I like the slow, steady approach to detoxification. But I will say that there are some great physicians in the world who seem to be able to handle right where their patients are and can adjust the chemicals in a way that helps them detoxify a little more quickly.
I like this slow approach. Add a greens juice in, the high dose vitamin C, those are so fantastic. And it's also what the organs can bear. It's what the life can bear. Are they in stress? Are they sleeping enough? Are all of the other factors actually supporting that detox?
Oh, you're right. You're absolutely right, Lars. Yes. Then there's just nothing like a good, healthy nutrition to help us detoxify. Plenty of those good greens like you just talked about. Cilantro's a wonderful chelator, a nice, gentle chelator. Chlorella is a gentle chelator. So we even, believe it or not, in the protocol that we follow for removing mercury amalgams from people, we have patients rinse and swallow with a solution of chlorella before we ever even start. Mm.
That is so interesting.
Mm-hmm.
Dr. Nunnally, you've spent a very valuable hour of your time today. Truly appreciate your knowledge, your wisdom, and to introduce us to a realm of dentistry that few may ever have even heard. So this is really tremendous. Thank you for that. Now, how do folks reach you and get a hold of you, and what does the whole protocol look like in terms of getting started with you?
Well, that's most people just Google our name. My partners are actually have 3 wonderful partners now, but there are 3 of us whose name is on the sign, and that's Nunnally, Freeman, and Owens. And so I have these marvelous partners who have been with me for some time. And most people would go to our website, which is healthysmilesforlife.com. And they'll reach out to us that way. We have a fabulous staff who are trained to answer people from all around the world, and they will ask the patients to send us one of these panoramic type x-rays where we can look at it and get a real good feel for what the patient might need. And we try in advance to give the patients a great idea of how long it's going to take us and what the fees would be. And usually it's very, very accurate, so that there are no surprises when they arrive. That's the way people do it.
Thank you for that. Dr. Nunnally, do you have any closing thoughts for us?
No, but I appreciate you, Lars. Thank you very much for having me today. And the wonderful thing I want to tell you about this is when I started doing this, there were some great pioneers in this long before me. Weston Price, who I mentioned earlier, Hal Huggins. There's some great pioneers on whose shoulders I stand. But what I would say is our International Academy of Oral Medicine and Toxicology, to which I've belonged only maybe for 14 or 15 years. When I first joined, we maybe had only 200 members, and now we have in excess of 900 members in that academy. And largely that's being pushed by the public. The public is going to their dentist and saying, how do you know how to safely remove these mercury fillings? Or do you have a mercury scavenger on your office so it's not going into my drinking water? There are all kinds of wonderful questions that patients are posing to their dentist today that are driving them to the fact that there's a different way to do dentistry. And I think it's a much safer way to do dentistry for the patients, for the dentist, for the staff, and for the environment.